And, you have to understand that you need to start taking real responsibility in your children's life. Like what you're going to learn about the education system and the challenges children are facing. I mean, it's no wonder they're depressed. It's no wonder they're confused.
Hey everyone, Tamara Ugolini here, and I have some exciting news to share with you. The National Citizens Inquiry is hosting its next round of hearings in Edmonton, Alberta, starting March 6th, 7th, and 8th. And this time, the focus is on a critical question: are children safe in Canada? This citizen-led, citizen-funded inquiry will dive into important issues such as child trafficking, drug safety, the often overlooked issue of EMF exposure, and so much more. In today's report, I sit down with Sean Buckley, who is the lead counsel for the NCI, to talk about what exactly Canadians can expect from these hearings and how you can get involved. Experts will be tackling topics such as parental rights, child protection, censorship, toxin exposure, the dramatic increases in neurodevelopmental disorders like autism, ADD, ADHD, and the list literally goes on and on. Buckley begins our discussion by highlighting the importance of the topics ahead of the next round of hearings, including some of the difficulties the NCI has faced when trying to secure expert witnesses to testify.
So if you look at our 2024 Vancouver hearings, which were our first 3 days on that topic, it is disturbing. And this next set of hearings, it's on the same topic in Edmonton, so March 6th, 7th, and 8th. If anyone's in the Edmonton area, please come in person, and we are live streaming. But it's almost like it's a forbidden topic. And I could tell you some interesting stories of the types of witnesses that it seems like it's forbidden that they can't testify. Like we had an expert on MAID that we tracked down who, actually testified in Parliament. And this person, I'm going to try and not to identify the person, but, is a professional that is in that field and was actually complaining to us, I'm frustrated with my colleagues who, would not be willing, they're telling me, to refer a child to MAID. Because what the issue right now is the federal government is proposing to let's extend medically assisted dying to mature minors. Literally a 13-year-old girl that, broke up with her boyfriend and, her friends are ostracizing her, so she's depressed. Once we allow depression in there, can consent to, medically assisted dying. That's the type of thing we're looking into. But anyway, this expert is complaining about how the colleagues won't say anything publicly, and then gets back to us a week later saying, I can't testify, I can't lose my job, I can't afford it, which is interesting. So testifying at the National Citizens Inquiry could lead to your dismissal. We had an expert in bullying lined up to, kind of talk about how prevalent it is, what it looks like, what the effects are, how you can prevent it. And the person is an expert in the interventions, what works, what doesn't work. And we're all excited. We spend a lot of time working with this expert. And then the expert's university basically instructed the expert not to testify. So the irony there is our expert in bullying just got bullied not to testify at the NCI. And we have a sitting MLA, I won't tell you from what province, that we weren't going to violate caucus privilege. We were just going to have the MLA explain to us really how powerless they are on these issues of importance to child safety to have any difference at all, even though they're a member of the government caucus. But that person let us know yesterday that they would basically be kicked out of caucus if they were to share basically, how the system works and what it's like to be an MLA. So we're clearly where we're supposed to be because, witnesses are being forbidden from participating in our hearings.
One particular topic that stood out to me as not being discussed frequently enough is on electromagnetic fields called EMFs and the long-term health effects of EMF exposure on children, particularly in the context of ever-increasing levels of screen time and the proliferation of wireless technology in today's society.
A lot of people have no idea that all of this wireless radiation around us, we call it EMF, electromagnetic frequencies, that they're actually harmful, as my understanding is, for all of us. Like Stanford did a study, Stanford University, on the Wi-Fi frequencies. And basically it breaks down our cells at the mitochondrial level and causes free radicals. So for all you ladies out there that want to age faster, that's how you age, make sure you have strong Wi-Fi in your house. So, that's the key. And if you want, cancer. But it's interesting, we've got an expert coming, Dr. Meg de Havas, and it used to be if children were getting sick in part of a school, or if children were having behavioral problems as a group in part of a school, they used to go in and check for chemicals as the first check. Now the first check is dirty electricity, and I'm willing to bet almost no one listening to this even has an idea what dirty electricity is. And then the second thing they check is for things like Wi-Fi, which can have profound effects on children's health and their behavior if it's too strong. So we're really looking forward to that. And Dr. Meg de Havas is actually the scientist that first blew the whistle on acid rain. She relies on research. She's very methodical. And I think your viewers will be intrigued.
More broadly, Buckley says that the event will address all forms of child abuse.
We're going to be talking about, just, in addition to what we've already spoken about, child abuse. So, Theo Fleury is attending in person to share his story. We also have an expert on, child sexual abuse. We're having another expert who's actually interviewed and is an expert on why male victims of sexual abuse don't report the abuse that they've suffered. It's actually fascinating evidence, and some of the stories that she can share are going to be riveting. We're going to be talking again about food safety and drug safety. So, educational issues, sexualization of children in the classroom. I mean, the list just goes on and on. We're very pleased we're going to have Dr. Robert Chandler, who's flying up from Los Angeles, to speak to us about the latest information that's coming out from the Pfizer dump. So he works with Naomi Wolf's team on the Pfizer dump, and he has from the very beginning, and he's going to share in relation to children, in relation to pregnancies, what's happening there. We have Mr. Del Bigtree coming in person, and I haven't interviewed him yet, but I want him to talk about what's happening with Make America Healthy Again, what some of the challenges that are being faced there by Mr. Kennedy and his team, why those issues that they've identified in the executive order to set up the MAHA Commission, why they were picked, what's important about that. And I think also I want to ask him about, media treatment. He's just really faced media opposition over the years. And now it seems that, there's an opportunity for there to be a change there. So
overall, the role of the NCI is to listen, learn, and make recommendations. Buckley emphasizes that the first step in all of this is to expose what is happening. With concerning trends like the rise in chronic disease, neurodevelopmental disorders, and increasing child trafficking events, I asked Buckley what the public can expect from these hearings in terms of prevention and protection to shield children from harmful environmental, medical, and societal influences.
Well, the first step is find out what's going on. And for child trafficking, we're going to have some fantastic evidence at this hearing. In the October hearings, and please watch those also, we started with Lee Dundas, who's an international expert on child traffic. She briefs all of the big agencies in the United States, FBI, CIA, all of that on child trafficking. And she told us how prevalent it is and what you watch for and how you stop it. We ended those hearings with a person that was child trafficked and managed to get out as an adult. And actually is one of the survivors, because we have figures on, they don't live long once they're child trafficked. They don't live long at all. So what you can get from watching these NCI hearings is you're going to start seeing these issues. So as a parent or as a grandparent, first step is well, what is the problem? And the second step is then, what am I going to do about it? You've mentioned children, looking at screens and things like that. That's actually an addiction. And, you have to understand that you need to start taking real responsibility in your children's life. Like what you're going to learn about the education system and the challenges children are facing. I mean, it's no wonder they're depressed. It's no wonder they're confused. And, if the parents and grandparents aren't going to solve that, what can we, that's where the responsibility lies, despite the fact that you'll learn that the school system is actively alienating you. And the reasons for that, you'll find shocking. If I can just kind of segue into this gender identity issue, which is confusing as can be for somebody like myself. I'm preparing for a witness earlier before this call who's been a teacher for 22 years. And the teacher's actually talking about, well, what happened to her teenage daughter when she got into a classroom with a teacher activist, and how basically her daughter got confused. And at that time, and this is a few years ago, the daughter was being taught about 43 different genders. Well, like now, depending on which source, like 83, 72, the list of genders is, it's difficult to keep up with them, literally. So, but these children are being confused, and if parents are in any way resistant to a child identifying differently or transitioning, in the culture of these teachers, they actually believe that, well, it could be harmful to the child. The child could become suicidal, and so to protect the child, we won't tell the adult. We won't tell the parent what's going on, which is somewhat frightening because we actually have learned at the NCI that it's that these children that actually are at risk of suicide, but it's because of the gender confusion and the stress that that's causing. And then you alienate them from the parents, those that actually can intervene and solve the problem, and you really have a recipe for disaster. So,
if you ask me, the issues threatening the health and well-being of our children are nothing short of a ticking time bomb, and they demand far more attention and action than they have received. So hopefully this is the first step in that direction. For Rebel News, I'm Tamara Ugolini. Canadians have long suffered under a system where inefficiency and corporate interests shape public policy, especially in healthcare. And it's clear that we need a bold shift, like what is happening in the United States under the Department of Government Efficiency. If you agree, then please head over to /thebureaucracy.com. There you can support our work and put your name to our petition. That's /thebureaucracy.com.